Good afternoon, all of you. This is Dr. Ruchi Shirurkar. I have been conducting sessions on homeopathic approach towards cases of autism and ADHD and behavioral disorders. But in last 2 years, I have realized that the cases of children who have been diagnosed on spectrum, it can be mild to severe, has increased many-fold. And I've realized what could be the real reason. The first reason is the stress during pregnancy. The parents have a lot of stress, they are working, so the stress during pregnancy, their fear, anxiety, insecurity can play a larger role in a child in later years of life. Second can be the amount of medicines that you take during pregnancy. What medicines are you taking during pregnancy? Third is, after the child is born, the increased screen time. I have seen in COVID that the parents, I don't blame them, but the parents are busy with their office works on laptops, and the children are glued to television sets for hours together. So increased screen time has a direct correlation to the number of increase in cases of autism. So I would request parents to absolutely, if you see any early signs of autism or ADHD, reduce your screen time to absolute zero, not reduce, just stop the screen time. What I'm going to narrate some early signs that you can pick in your child and always seek help. The first and the foremost is delayed speech development. Either the child is not talking or is speaking very few words as compared to the age. The child is 3.5 years old or 4 years and hardly talks. The child is not even responding to your commands. For example, you ask, baby, come here, you're calling out the name, but the child is absolutely not responding, as if he's not interested or he's not able to hear, right? A lot of parents go to an ENT surgeon or an ENT doctor stating probably there is some problem with hearing, but when you do an audiometry test, the child ear are absolutely normal, there is no defect. So delayed speech or no speech, no response to your commands. And the third is toe walking. A lot of children walk on toes at some point of the life. That is not a consistent toe walking. Parents would say, keep your foot down, still the child walks on toes. Poor eye contact. When you are talking to the child will not look into your eyes, will be distracted, or no eye contact at all. Fourth is hand flapping. They will do like this. This is also called as stimming, which is a self-stimulating behavior. It's a sensory issue with these kids. You'll see a lot of, they keep doing this during the day persistently, right? So hand flapping, which we also call as stimming. We talked about speech, poor social, association. He will not have a lot of friends. You will say that, okay, he's not talking, so probably he doesn't have friends, but you will observe that he's not even interested to make friends. He's usually the loner type who would play in the corner. He will not mingle with other kids. He would like to play alone. He will not understand the other person's emotions. For example, there's something sad which has happened, or other child has fallen down. He is not able to associate with those emotions. Appropriate response in such situations, the child will not be having. Increased hyperactivity. The child can be extremely hyperactive. I had patients where parents say, we cannot go to a restaurant and eat. He's all over the place. Extreme hyperactivity. A lot of tantrums, in children. A lot of behavioral issues. They can be aggressive. They can hit themselves and hit others. Throw tantrum. Every child or some children throw tantrums, but with these children, even if you give in to their demands, like for example, the child is crying for this pen and you give the pen, still the tantrums doesn't subside. It is like a sensory meltdown, we call it. They just do not know how to stop. They can be obsessive about one thing. For example, they always want to play with one toy, or they always want to see one particular program in television, or they want to wear one type of cloth only. It is called as monomania, the repetitive behavior. There is also echolalia, whereas repetition of the words that you talk. For example, you say, what do you want? So they would repeat, what do you want? What do you want? You know, they keep repeating the words that you are talking to them or you are saying. So the repetitive echolalia, we call it, it's echoing, you know, they repeat the words, whatever you are saying. Yeah, I have narrated most of the points. So it's not a, you know, it's not a diagnosis that you can go to the lab, get a test done, and you know whether your child is on spectrum or on ADHD or has some behavioral issues. It's my experience that the earlier you start, for example, I have parents who come to me when the child was 2.5. I'll not say he was diagnosed as on spectrum, but there were very early few signs here and there. You know, the child is walking on toes or not interacting or not getting proper speech or not responding, and we have wonderful results. So earlier you start, the better the results. If I'm not saying we are going to diagnose it as okay, it's a spectrum disorder, it is not important, but you can take adequate measures like, you know, occupational therapy, speech therapy. Homeopathic treatment really works very, very good in such cases. I have been working for autistic children. You know, earlier I had a lot of failures because I didn't understand how to prescribe, but now since last 2-3 years, after a lot of research and hard work, I have realized how to interpret and understand these kids. So if you know someone around you, you know, always seek help. Consult a doctor. Sadly, I would not recommend you to take any medicines like Ritalin or Aspirin for such hyperactivity or mood stabilizers, because they can be detrimental for your child and they are not curative. So I personally am strongly against any allopathic medicines for such children, but homeopathy really works. And I said the earlier you start, the better the results. Speech, you can see the speech development, the sensory issues goes down, the behavior, the aggressiveness also comes down. Yeah, so if you see in your child or anybody around such smaller issues, you know, and persistent issues, always consult and seek a help. You know, as I said, it can be 100% curable if you start early, if you start the treatment early. By treatment, I do not recommend allopathic medicines for your child, but if you start early, there are wonderful results and you can really help your child to, you know, lead a normal life like any other kid, right? So I am conducting these sessions on autism, and this session that I'll be conducting tomorrow, which is 24th of August, I'll be actually showing cases. You know, a lot of doctors talked about, okay, you have to take pregnancy history, you have to take stress during pregnancy, but nobody talked that how you have to interpret that stress. For example, a lady has a stress during pregnancy that I was very fearful and very anxious, and I always felt there can be something wrong with my child. So what remedy and how will you interpret? For example, a lady felt very insecure or lonely, then what remedy? Or I felt very irritated and I did not want to talk to. So I will actually show cases what kind of stress the lady has and what medicine you should think of, and cases which are cured and have wonderful results. So yeah, this is my attempt to teach homeopathic doctors that how it is very different from the case taking. The interpretation is absolutely different from the case taking of any other child. For example, this child has biting issues or aggressiveness. So will you take that in totality? Will you take that in higher in totality or lower? So the approach itself is very different, you know. Initial years of my practice, I also failed where I took the expressions of the child, कि जो दिख रहा है उसको rubrics में convert करिए और totality बनाइए. It doesn't work. I have failed in so many cases before I came to this understanding of how to take this case and how to evaluate such children. Right, so this video is also information for people, common public, that how to, you know, pick and understand what is the problem in your child and consult a doctor. And it's also for homeopathic doctors who want to treat such children. We are training homeopathic doctors, you know, so that we all can give better results in the society. So thank you, and those who want to attend the session can contact me. Thank you.